Hi everyone, this is Dr. Renu Nair, dermatologist and hair transplant surgeon at Dr. Renu's Skin and Hair Clinic, Bangalore. Dandruff or seborrheic dermatitis is one of the common things that most patients come to us for treatment. It's a very common condition. It can be seen in any age group starting from infants to adulthood. Infants, you might see this as cradle cap, and as we go on to the adulthood, you can see it as a proper dandruff. So what exactly is this? This is basically an inflammatory reaction produced by our body against the excess buildup of sebum or the oily secretions, along with the presence of a local fungus, that is Malassezia. So our body's immune system targets against the sebum and the Malassezia fungus and produces an inflammatory reaction which results in dandruff. We have different types of dandruff. One is the dry type and the wet type. The dry type is basically called as dandruff, where you have dry powdery scales on your scalp associated with a lot of itching. The wet type, you will have greasy scalp along with yellowish scaly patches, and you can also have painful pimples associated with it. So what are the triggers for these dandruff? One of the main trigger is stress and lifestyle. So if we have bad lifestyle practices, we are under stress, we find that dandruff gets triggered. Then extremes of weather conditions, if it is too cold or too hot, that can also trigger dandruff. Bad hair care practices where you don't wash your hair properly or apply a lot of oil or hair styling products can also aggravate your dandruff. So how do we get rid of it? So the main medical management is by using certain medicated shampoos. So these shampoos, they help to remove the sebum buildup and the local fungal activity and thus treat dandruff. We have a variety of medicated shampoos with a lot of ingredients starting from zinc sulfide, selenium sulfide, ketoconazole and certain steroid based like fluocinolone shampoos which helps to take care of this inflammatory action. If the seborrheic dermatitis is little more severe, we add on certain leave-on lotions containing either ketoconazole or a mild steroid. This also reduces the inflammation related to the dandruff. And if it is too severe, we also give a short course of antifungal treatment, oral medicines, which takes care of it. So what are the good practices that you can do in order to ensure you don't get the dandruff again? The main thing is lifestyle. Have a healthy lifestyle with a good antioxidant-rich diet containing zinc, which helps to improve your dandruff. And also try to reduce stress to the extent possible. Have a good hair care routine in order to avoid the dandruff buildup. So you can wash your hair more frequently if you have dandruff, especially if the scalp is oily. Even daily or at least alternate days head bath is good in order to prevent the sebum from building up. But if you have dry scalp, you should not do so frequently. At least twice a week should be good enough to ensure that dandruff doesn't come. Avoid putting oil and leaving it on because this also increases the sebum production in the scalp. So if you want to use oil, use it probably half an hour before bath. You can do a little bit of warm oil massage and wash it with an anti-dandruff shampoo. Do not put oil and leave it on overnight. The same goes on for hair styling products. Keep it to the minimum and make sure you wash it so that you don't get dandruff. So one important thing I would like to say about dandruff is it is something which comes back if you don't take care of it. So many times patients come to us, they say that I got it treated but it is again coming back. Is there a permanent solution to it? Unfortunately, it is a reaction by the body to something that is always present on our scalp. So we need to take care of it. We need some maintenance to ensure that you don't get it again, and it is very simple to do these maintenance things. The most important being using the right medicated shampoos. So these anti-dandruff shampoos, if you continue at least once or twice a week with a good hair care practice, can go a long way to ensure that you don't get this dandruff again. Thank you.